Okay, as my peers have done, I would like to give you my intake about the profession, where the profession is right now, where is it going, where I think it's going, give you a bit of advice. So first of all, I know that Jill already spoke about this a bit, but I think it's important for us to understand the differences between programs that are meant to produce or ordain clinical exercise physiologists as opposed to exercise physiologists. There's a distinction made, at least at the accreditation level of programs, between applied exercise physiology and clinical exercise physiology. I will just say that as a program in clinical exercise physiology, the focus is the ability to conduct rehabilitation of chronic people with chronic diseases, clinical populations, with the help of exercise. Um, the classical aspects are probably cardiorespiratory and cardiovascular, but I would add into that metabolic diseases, mental health, which I think will become very serious in a future field of focus, renal diseases, which I think is not dealt with because people are afraid to deal with these populations, liver diseases. Um, so those are fields that I think that have to be developed and have a lot of room and space to be developed. So if you're interested in being a bit different, those are directions that you can go. Um, I think that the applied exercise physiology deals less with diseases, with chronic conditions, and more about the application of the principles of exercise physiology and exercise testing to different areas. It is my life experience and my professional experience up to now that an exercise physiologist can work with the military, can work with industries, equipment, applications, um, teach at universities, obviously work in a clinic or in a gym at a higher level, or the fitness industry at a higher level than the common gym instructor. Um, and basically just contribute to so many applications that have to do with people that are not in the position or physiological situation of rest. I think that, and this is what Jill and I thought, Dr. Newstead and I thought when we decided to take the program from human performance a few years ago to clinical exercise physiology, is that when you know how to deal with clinical populations, obviously you have to learn in the process how to deal with non-clinical populations or supposedly healthy populations. When you're dealing with applied physiology or exercise physiology, you don't necessarily know how to deal with clinical populations, and I think that is an advantage that our students should have in comparison to other populations. Um, as I've mentioned, and I truly believe one of the major fields that should be developed and probably will naturally is rehabilitation of renal patients. It's not that it doesn't exist. I think it's not developed to the full length, depth, and width that the field should have. There's definitely a need for it. I think that mental health and exercise is not utilized enough, and I hope that those two fields are developed. I can tell you that from my experience, and I mean not to sound arrogant, but there are populations out there and professionals that are working in rehab that don't have the knowledge and exercising people like we do. I'm not saying that they're not intelligent. I'm not saying that they're not capable of doing it. I think that they're not ordained. And when you look at their transcripts, they did not have enough courses to be the right people to work with those populations. And that's where we come in, and that's where we have to advocate for our profession. I think that a major, did I say major? Field that it's going to develop, and I'm definitely leading that field and intend to lead it, is exercise prescription according to genetic information, according to SNPs. The ability exists. I think the field needs to be established and developed, and I'm working on a clinic that deals with that here in Bismarck. Obviously our field has to go towards licensure, and there's one state that already has exercise or clinical exercise physiology with licensure. There's a few more states that the bills are on the table, and I believe that every state at the end should recognize us as a profession within itself, that only certain people with a master's degree in clinical exercise physiology should be working in rehab. That would probably, not necessarily, but probably be people with the equivalent of an RCEP, a registered clinical exercise physiologist certification, and a master's degree in the field. I do not think that nurses should be working in it. I don't think that PTs should be working in it, but that's my opinion. And I think that it's a profession within itself, and it should be done by people like us or you when you graduate from your master's degree, that are dedicated to the field. We definitely see clinical exercise physiologists as leaders. We have lots of information and lots to give in the clinical setting, no matter where, and can operate and collaborate with any other professional, always adding to the knowledge, always adding to the abilities of the team, and even leading the team. We definitely see the program bringing out your leadership abilities and your management abilities as well. I think that even once you graduate from the program, and even now as students, you have to be versed in current knowledge and trends and what's going on there, and constantly keep reading research and articles to be up to speed with what's going on out there, and we'll definitely try and teach you and encourage you to do that. So that's my opinion about the field, and I hope you enjoyed this video. Have a great day.